from developing drugs and protecting the food supply to treating companion animals and investigating animal diseases in the wild. A veterinarian is a medical profession who is responsible for the health and well-being of both animal and people. The veterinary doctors prescribe medication and cure animals that are sick or injured, as well as diagnose and control animal diseases. In addendum, veterinarians have an important part in our society and do an excellent job. It has quite a lot to consider because they are responsible for the care of animals in general. Good afternoon, Dr. JB, and to our classmates. We are the third reporter, and our report is all about the role of the veterinary profession and individual veterinarian. What are the roles of the veterinary profession in animal welfare? First, they often enshrine in an oath. Second, the professional body may involve in making professional policy. Furthermore, they influencing legislation. Next, being a spokesperson for animal welfare, like for example, the Philippine Animal Welfare Society or PAWS, World Animal Protection or WAR, and PETA or PETA. Lastly, ensuring the quality of vets who can practice in that country. What is the professional oath? The professional oath, it varies with each professional body and usually includes reference to animal welfare. Here in the professional oath, when members of the professional take an oath, they can formally adopt the veterinarian's intended role in animal care. This is a wonderful method to emphasize the dedication to welfare both within and outside of the profession. Contradiction possible professional integrity. The oath may also include a section on improving knowledge, public health, and other topics. Various elements of the oath may be in conflict with one another. Like said above here, contradiction is possible. And for instance, progress in knowledge may be made at the expense of welfare. If there is any conflict between the two components, the oath in a given situation, instruction of which shall take priority should be provided. The oath may also serve to remind vets of their responsibility to entire profession. It usually contains the portion where the practitioner promises not to bring the profession into dishonor. Next, making professional policy on animal welfare and ethics. In making professional policy on animal welfare and ethics, members must follow certain policies. Sanction can include being struck off. Following policy may not always result in right action, and guidelines can be produced to help the professional ethical issue. Professional policy are the rules that govern how members of the profession behave. A professional policy may state, for example, the member must obtain the agreement before doing surgery on their animals. Professional policy usually represent the majority of the profession viewpoint. There should be a way for members to express their opposition to policy formulation or to strive to alter existing policies. So, in order to enforce policy, it is critical to have an effective disciplinary framework. Sanction will come from within the profession, and they could range from a warning to barred from practicing altogether. Criminal crimes should be handled by the police, but if necessary, such matter can also be addressed by the professions or to the doctors. For example, again, a veterinarian may believe that doing a different or additional surgery on animal while it is under general anesthesia is proper thing to do. However, if the veterinarian does not obtain the customer consent, he or she may be in violation of a professional policy. Also, the policy may also be expanded into useful guidance for vets in difficult ethical situations like dealing with low-income clients. includes provide expert independent advice for government, comment on proposed legislation and suggest future legislation. So here, influence legislation on animal welfare. A political party should not be associated with the profession in any way. It can provide a independent recommendation to government on animal health and welfare issue in this role. The veterinary profession is the best place to comment on many aspects of future legislation. It is the profession's responsibility to provide this unique perspective to the government. The veterinary profession, for example, is particularly concerned with the issue of animal welfare, such as ensuring the euthanasia is carried out in a humane manner when an animal must be killed. The profession can also proactive in advocating for government legislation as a result rather of reacting to other factors. It might act as a catalyst for change. Next, spokesperson for animal welfare. Spokesperson for animal welfare. Profession in a unique position to promote animal welfare. Governing body should communicate welfare ethical policy to the general public, provide comment on topical issue. So here, veterinary medicine is a unique position to speak on animal welfare. Veterinarian may have received substantial training in this discipline, either formally or informally, and are frequently in direct range to animals or circumstances involving animals. So here, the veterinary profession must likewise be viewed as being in unusual circumstances, otherwise members' skill will be wasted and public acceptability of the condition will be low. This could be accomplished through effective communication. It is important to avoid giving the impression that the profession is only focused in making money. The profession could also speak on contemporary animal issues in the media, or in order to increase the public awareness of the profession perspective, it could also provide media commentary on current animal issues. Next, ensuring quality of vets. Ensuring quality of vets should promote animal welfare, and it could be done by ensuring the quality of veterinary degree and requiring an exam to be passed to join the profession, and should be independent and rigorous. So a high quality veterinarian will be better qualified to support animal welfare. So for example, through improved surgical abilities and medical understanding, the profession can explicitly govern who can join it and ensuring that the members are high quality. It is critical that the joining process be self-contained and transparent. Okay, and next, veterinary training. So here's some photos where veterinary training is done. Here in veterinary training is veterinarian will be able to involve their students in conversation about animal welfare and ethics, in addition to teaching practical skills. Even teaching ordinary surgical operation will provide a platform for ethical and welfare discussion. So next, the role of individual vet ethical decision making in veterinary practice. Here, the role of individual vet in ethical decision making in veterinary practice. So first, they need robust, logical, and consistent reasoning. Second, ethical dimension in almost every veterinary action. Next is following a framework can be helpful and more than just a feeling. Here in the role of the individual vet ethical decision making in veterinary practice. So in a regular basis, veterinarians are involved in ethical decision making when prescribing a medication for an animal. For example, the benefit of the treatment is assessed against the expense of the side effects, the animal's mode of administration, or the monetary cost of the owner. Logical thinking is necessary to ensure that the correct option is made. This could indicate how you feel about the scenario in general. However, it is important to not blindly follow popular opinion without considering the implication for animal welfare using a framework to assist with a decision making can ensure the rational approach is followed. So last, a framework for ethical decision making. A framework for ethical decision making. We have 6 steps that are appropriate framework for ensuring an appropriate decision is made with regards to difficult clinical cases, and these are the steps. First, identify possible courses of an action. Second, establish interests of affected parties. Third, identify the ethical issue involved. Fourth, establish legal position of the dilemma. Fifth, choose a course of an action. And sixth, minimize the impact of the decision. Now, the next 12 slide will be taken over by Miss Jenny Buduan. Without further ado, Miss Jenny, please take it away.
Thank you so much, Miss Cabenta. Good afternoon, everyone. This is Jenny Rose Buduan, giving you the latest Chika Chika Mini. I will be discussing the 6 steps that are appropriate framework for ensuring an appropriate decision made with regards to difficult clinical cases. So, the first step is to identify all the possible courses of action. If a viable line of action is overlooked at this point, its potential benefits cannot be explored. At this point, there is no moral worth assigned to any of the options. This is merely a research project. The values will be used later to decide on the course of action. No treatment, palliative treatment, active treatment, further diagnostics, referral, euthanasia are all choices for a clinical case. However, many other veterinary scenarios, such as developing a practice guideline, do not include a clinical case. For example, when considering a case kung papatayin ng isang asong babae with urinary incontinence, kawalan ng pagpipigil sa ihi, which has proved unresponsive to medical therapy, the possible courses of action may include euthanasia, mercy killing of the bitch, walang aksyon, or referral to a specialist center to perform a new surgical technique. The second step is establishing the interests of affected parties. It can be difficult but will allow consideration of underlying motives to establish whether they are reasonable. For example, is it legitimate for an owner to say that the animal is inconvenient? Sa tingin niyo po, ang abala ng pagtatae sa bahay ng animal. Parties involved include animal, owner, and yung vet. But there may be wider parties to be considered than just those central to the case, such as the profession and the society. Conflicts between parties often central to dilemma. Very often, these conflicts between the parties are the cause of the dilemma. If everyone is in agreement, then there is no often dilemma. Using our example of the incontinent bitch, the owner is interested in keeping the house free of urine. The bitch is basically unaffected by the incontinence providing urine scalding does not occur, but would suffer some short and longer-term pain and distress associated with the surgical option. And the veterinary surgeon may feel strongly that the unnecessary euthanasia requested by the owner is wrong. It is at this point that the economic issues need to be considered, as they may have a reasonable or unreasonable effect on the decision. Some might argue that a veterinary surgeon's motivation to generate an income would be an unreasonable motive that should not be included within the ethical decision, whereas the ability of the owner is to pay for treatment may be relevant. Some of the interested parties consider the situation. The animal, the owner, and the veterinarian may or may not be interested in the ethical problem. The third step is identifying the ethical issues involved. It might be difficult to pinpoint the dilemma's underlying ethical question. However, this is necessary in order to focus on the most important subject. Sometimes, complex situations have more than one ethical dilemma, and this can be difficult to resolve. Some of the ethical issues in our example include: should a vet always do what a client wants? Is the length of life of an animal important? The fourth step is establishing the legal position in the dilemma. Veterinarians are expected to act in a legal and ethical manner. Professional guidelines can sometimes assist in the formulation of a policy. After considering ethical considerations, they may not support the right action. In our case, there may be professional guidelines governing whether or not a veterinarian must comply with the client's euthanasia wishes. Let's refer to the next slide for RCVS, Royal College of Veterinary Surgeons recommendations. RCVS Guidance 2000. No veterinary surgeon is obliged to kill a healthy animal. The veterinary surgeon's primary obligation is to relieve the suffering of an animal, but account must be taken not only of the animal's condition but also the owner's wishes and circumstances. Where in all conscience, a veterinary surgeon cannot accede to a client's request for euthanasia, he or she should recognize the extreme sensitivity of the situation and make sympathetic efforts to direct the client to alternative sources of advice. The RCVS issued this advice in response to a debate in the Veterinary Record magazine in the United Kingdom regarding disciplinary actions brought against a veterinary surgeon for refusing to euthanize a dog with urine incontinence against the client's wishes. The fifth step is choosing a course of action. By employing a logical ethical theory to make the decision to follow a certain course of action, the grounds on which that decision is reached will be evident. It is critical to comprehend the theory that is being used. For different situations, different theories may be more appropriate. Using our example, a deontological rule may be used to rule out severe or long-term suffering and anguish for the animal at first, because none of the possibilities fell within this category in this situation. A utilitarian analysis evaluating the costs and benefits to all stakeholders for each option was possible. These are the advantages of euthanasia. Improved house hygiene, ability to accommodate clients' requests. Disadvantages is shorter life of the bitch means less companionship for the owner, and it goes against the value of the veterinary surgeon. No action is taken. Advantages, none, save that there may be no pain for the animal. Poor house hygiene is one of the disadvantages. Surgical procedure that is new. The advantages include improved housekeeping and academic interest in the profession. The disadvantages include surgical pain for the animal as well as time and financial costs for the owners. The last or the sixth step is minimizing the impact of the decision. Even though a choice has been taken to take one course of action, there may be methods to mitigate any negative consequences. This might involve utilizing a more effective analgesic regimen or offering counseling to irritated owners. Essentially, you are fine-tuning the decision's welfare impact. The 3 R's, replacement, reduction, and refining, are commonly used on laboratory animals, and this refinement notion is one of them. The further explanations of the 3 R's will be discussed sooner or later by the other group. If the surgical option is chosen in our case, precautions should be taken to reduce the animal's discomfort and anguish, such as effective analgesia and nursing, as well as the time and financial consequences for the owners, such as paying in installments. In addition to applying the framework outlined above to make an ethical decision, it's also a good idea to think about medical ethics guiding principles. So these are the 4 principles of medical ethics or healthcare ethics. The first one is autonomy, non-maleficence, justice, and beneficence. Autonomy, respect a person's freedom to choose what's right for them. Non-maleficence, do not harm. Justice, treat and provide care fairly to all patients. Beneficence, all choices for a patient are made with the intent to do good. For the further explanations, isa-isahin po natin siya. So, the first one is non-maleficence, wherever feasible. The concept of not doing anything detrimental should be observed. In medical or veterinary conditions, some damage is almost always present, although this is often outweighed by a long-term or total benefit. Let's say, for example, surgical removal of a tumor may cause harm in the near term owing to probable discomfort and surgical risks, but the animal will profit in the long run since it will live a longer and pain-free life. Secondly, beneficence. Once the degree of damage has been reduced, the promotion of good should follow in all cases involving that case. When a diagnosis is made, for example, therapy should be started as quickly as feasible. Third, autonomy. It is seen as crucial in medical ethics. It applies to animals in a somewhat different way since they are frequently unable to be entirely self-governing. For instance, they are rarely able to make choices about treatment they receive. 2 independent creatures may have opposing rights that must be reconciled. Consider a songbird's right to live against a domestic cat's right to conduct natural behavior. The freedom to display appropriate behavior is linked to allowing an animal to make choices. Fourth, justice. Concerns the equal considerations of animal and people. In practice, there are three approaches to attain justice. The approach used might be based on basic principles or case-by-case considerations. Number 1. To begin with, every resource might be distributed exactly evenly. A rescue shelter, for example, might offer worming pills to all canines even if there weren't enough to give each one the proper amount. Number 2. If worming pills were in low supply, only particular animals, such as those that seem to be parasitized, could be given them. Number 3. If the tablets were be given to animals that would gain the most from them, animals that were likely to be rehomed may be picked to avoid human infection. Animals that are unlikely to be rehomed might be chosen instead, as those who are rehomed may be able to acquire them from their new owner. Now, this is the last slide that is assigned to me, and I am giving the floor to the last but not the least, Mr. Justin J. Bulatao. Mr. Justin, you may start now.
Good day everyone, I am Justin Bulatao and I will continue our discussion. Attitudes influence on decision making. Attitudes may have a positive or negative impact on the decision making process. Attitudes of concerned parties should therefore be considered. So as you can see here, meron tayong graph, no? Attitudes in vet students. So sa female students, very consistent ang empathy level nila from first year to final year. While sa male students, nagde-decrease siya every year. So this study was conducted by Paul and Podbersek. Reduced empathy reduces human care of animals. Male vets have been shown to use fewer painkillers during routine surgery. So yun nga, no, nakita natin kanina before tong slide na to, is yung male vet students, nagde-decrease yung level of empathy nila for animals. So malaki ang probability na pag naging professional sila, pag naging licensed veterinarians sila, lalo pang bumaba yung empathy nila for animals. Attitudes of veterinary surgeons and students. Logical ethical reasoning will reduce the effect of biased attitudes to animal welfare. So, dapat hindi tayo namimili ng mga hayop na i-treat natin. Dapat we treat them equally. If it needs some treatment, then ibigay natin yung pangangailangan nito. Huwag tayong mamili because of the breed, the size, or if it is a dog or a cat. Next, enable the right decision to be made rather than relying on common practice. So, I think the best explanation for this is what may work to your dog may not work to my dog. So you need to think of better solution or another way on how you will treat my dog effectively. Next, allow confidence in your professional decision. Some welfare ethical issues in veterinary practice. We have euthanasia of stray animals, confinement of animals during treatment, surgery of patients, treatment of wild animals, euthanasia of stray animals. We have some points to consider. First here is maybe healthy or unhealthy. If the animal is healthy, then it doesn't need to be euthanized. If the animal is unhealthy, it can acquire easily a contagious disease. It can be a spreader and a threat to any animals that surrounds that animal. Maybe a public nuisance, health hazard. For example, merong isang stray dog na merong rabies. Rabies is a very dangerous disease for animals. Kasi nagiging rabid sila. Nagiging wild. Diba? So, pag ang tao nakagat or nadilaan ng asong may rabies yung open wound, then pwede itong mapasa sa tao. And magkakaroon ng mental health condition yung taong affected ng rabies. Which is nangyayari din, or which is din yung condition na nangyayari doon sa aso. Does it have the right to a humane death? So, ang euthanization kasi, or yung pag-euthanize, is also called mercy killing. It is the act of putting to death painlessly or allowing to die as by withholding medical measures from a person or animal suffering from an incurable pain, disease, or condition. So, mostly sa mga na-encounter ko, yung mga na-euthanize na pets or na animals is yung dog. And yung specific breed is Rottweiler. Kasi pag tumatanda sila, nagkakaroon sila ng Alzheimer's, parang yun yung naaalala ko, no? Nakakalimutan nila yung owners nila, so nagiging aggressive din sila sa kahit sino, na kahit kanino. So they need to be euthanized kasi they can endanger themselves and other people's life. Next, what course of action will promote the overall good? Siyempre, ang pag-euthanize, hindi siya basta-basta. You need to consider yung mga apektuhan. For example, na yung kanina yung sa dog, if meron siyang rabies, then it needs to be euthanized kasi mahirap i-cure or hindi na-cure ang rabies. Confinement of animals during treatment. Here are some points to consider. How long will this be for? How much distress will this cause? What are the alternatives? How can the negative aspect of confinement be minimized? So, how long will this be for? So, dapat alam natin kung gaano katagal ang magiging procedure ng treatment and ng confinement para alam natin kung magiging effective ba ang treatment natin, and also di kailangan natin mag-allot ng time para hindi ma-prolong yung pain ng patient natin. How much distress will this cause? Dapat alam natin yung level of stress na ma-acquire ng ating patient para after the procedure or after the confinement, you can do another step para ma-treat natin or para mawala yung stress ng hayop or ng animal. What are the alternatives? We need to think some of alternatives. Alternative on how can we shorten the period of treatment, and alternative way of medication to lessen the pain. How can the negative aspect of confinement be minimized? So, paano nga ba natin mami-minimize yung negative aspect or yung negative impact nito sa ating pets? No? So, yun yung mga things to consider sa confinement of animals during treatment. Surgery of patients. So, some points to consider. Will the animal be in an unacceptable amount of pain? So, we need to know if the animal can tolerate the pain. Dapat i-consider din natin yung mararamdaman niya to lessen the pain. Kasi, kagaya nga nung pag-aaralan natin, yung nag-discuss ni Dr. Mardy na yung animal na nakakaramdam ng pain, it can affect its mental health. No? So, imbis na gumaling siya or mapabuti natin siya, magkaroon pa siya ng another problem which is yung sa mental health condition niya. What is the long-term prospect following the surgery? So, ano ba yung target natin? If yung after ba ng surgery nito is magkakaroon pa tayo ng another procedure para sa kanyang treatment, kung magtitake ba siya ng medications niya or therapies. Yeah? Next. Some points to consider again. Does the vet have sufficient expertise for the procedure? Siyempre, as a concerned pet owner, hindi ka basta-basta rin nagtatrust. I mean, hindi ko din na-downgrade yung mga fresh, yung mga baguhan lang sa veterinary, yung kakakuha lang ng license, yung kaka-practice lang. I know na pag-aralan nila to, pero it is better if yung mag-handle dun sa procedure or yung mag-perform ng procedure is meron siyang enough knowledge, no? And kasi if merong enough knowledge yung mag-perform, malaki ang chance na ma-cure agad or gumaling agad at hindi na magkaroon ng another complication. What are the interests of the parties concerned? So, dapat both parties know na kung ano yung procedure na gagawin, kung para saan yung procedure, at bakit gagawin yung procedure. Treatment of wild animals. Some points to consider. May be more adversely affected by veterinary treatment. So, ibang animals, hindi porket they are in the wild, they can live on their own. So, for example, merong commotion sa mga tigers, nag-away sila. Yung isang tiger, nagkaroon siya ng cut. Malaking sugat. Then, hindi siya agad-agad mag-heal. Pag napabayaan yun, pag hindi siya na-close immediately, pwede siyang magkaroon ng infection. No? Then, pag nagkaroon siya ng infection, possible na humina kanya immune system, maka-acquire siya ng disease, at may spread niya to. So, kawawa din siya and also yung animals na pumapaligid sa kanya. So, pag merong veterinarian na tatahiin yung wound, it may help to reduce the pain and also to prevent from infection. Some species may have special legal status. So I think this is for the endangered species and yung mga wildlife species na nasa conservatory. No? So hindi sila agad-agad pwedeng ma-treat without legal advice. Hindi sila basta-basta pwedeng galawin. Next, many wild animals considered as pests. Yes, so maraming pests, no? Huwag tayong lumayo. Rats. Rats are pests around the world. correct me if I'm wrong, pero ang alam ko around the world, they are pest. Sa bahay namin, they are pest. Sa bahay nyo, they are pest. Sa farms, they are pest. Can the needs of animal be fulfilled in short or long term? So, ito, sa mga places kung saan sino-surrender sa mga conservatory bang tawag doon, I don't know, I forgot. Sa mga places or sa mga specific o sa DNR. For example, sa DNR, may nag-surrender ng isang ibon na sugatan. Then, yung ibon na yon is meron siyang biyak sa beak, tapos gumaling siya after a month. Then, in-assess kung pwede ba siyang i-release sa wild. No? Kung hindi na siya pwedeng i-release sa wild, then that is long term. Pero, if the scenario is may sinurrender na ibon, sugatan, na treat, tapos nakita yung characteristic niya is aggressive, kaya niya pang mag-hunt on its own, kaya niya pang makipagsabayan sa ibang birds, then it can be set free back to the wild. And that is the short term. So conclusions and summary. The veterinary profession and individual veterinarians have a role in improving animal welfare. Robust ethical reasoning will ensure that the right course of action is identified. Many factors can influence attitudes to animals. That would be all. Thank you for listening. Again, I am Justin J. Bulatao, and my co-reporters are Jenny Rose Buduan and Princess Cabenta. Thank you for listening. We hope that you learned something from our report. Stay safe and God bless.